Before we get started, just a quick note. This video is for general information only and isn't a substitute for personal medical advice. If you have any concerns about your health, please speak to your GP or a qualified healthcare professional. So, you've been wondering whether Testogel might be right for you and how you'd actually go about getting it in the UK. Let's walk through exactly what's involved. Testogel is a prescription-only testosterone gel authorised in the UK by the MHRA. It's used to treat a condition called hypogonadism, where the body doesn't produce enough testosterone. Applied daily to clean, dry skin, it helps restore testosterone to a more normal level in the bloodstream. It's important to be clear about who this is actually for. Testogel is indicated for adult men with a confirmed testosterone deficiency who are also experiencing symptoms. Things like reduced libido, erectile dysfunction, persistent fatigue, low mood, or loss of muscle mass. It is not licensed for performance enhancement, and it's not suitable for women or children. So how does the prescribing process work? You cannot buy Testogel over the counter or online without a valid prescription from a registered UK prescriber. The process starts with a formal assessment, either through your GP or a specialist. To confirm a diagnosis of hypogonadism, you'll need at least 2 blood tests taken on separate mornings, ideally between 8 and 11 while fasting. Both tests need to consistently show low testosterone levels before a diagnosis can be made. This 2-test requirement exists because testosterone levels can naturally fluctuate throughout the day. Before any prescription is issued, your doctor will also rule out certain contraindications. Testogel is not suitable for men with known or suspected androgen-dependent tumours. That includes prostate cancer or breast cancer, as testosterone can stimulate the growth of hormone-sensitive tumours. There are also important cautions to be aware of. If you have cardiovascular disease, your doctor will carry out an individualised assessment as the evidence on cardiovascular risk with testosterone therapy is mixed. Elevated hematocrit, untreated obstructive sleep apnea, and severe heart failure are all factors your doctor will need to consider carefully. One more thing worth knowing, Testogel suppresses sperm production. If you're trying to conceive, this treatment would not be appropriate. Do discuss alternative options with your doctor. In terms of access, there are 2 routes in the UK. Through the NHS, you'll typically see your GP first, who may refer you to a specialist. Through a private clinic, you may be able to access assessment and treatment more quickly, though costs will be out of pocket. Your doctor can help you weigh up which route makes sense for your circumstances. Once you're on treatment, ongoing monitoring is essential. Regular checks of your testosterone levels, a full blood count, PSA levels, and prostate assessment. These aren't optional extras. They're a core part of using this medication safely. And do make sure you read the patient information leaflet that comes with your medication and always follow your prescriber's or pharmacist's instructions. If you're already on Testogel and notice anything unusual, changes in urinary symptoms, significant mood shifts, chest pain, or anything that concerns you, contact your doctor promptly. Don't wait for your next scheduled appointment if something doesn't feel right. To recap, Testogel is a prescription-only gel for adult men with clinically confirmed testosterone deficiency. Getting prescribed, it requires at least 2 blood tests and a thorough medical assessment, and once you're on it, regular monitoring is an ongoing requirement. If you think you might have symptoms of testosterone deficiency, the right first step is to speak to your GP or a qualified healthcare professional. They can assess whether further investigation is appropriate for you. Please don't attempt to obtain or use prescription medication without a proper diagnosis and medical supervision. Have questions about anything we've covered today? Drop them in the comments below. And if you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more medically reviewed health information.